Hello and welcome. Today, we're diving deep into a complex kidney disease known as Cryoglobulinemic glomerulonephritis, or cryo-GN for short. This is a condition where abnormal proteins in the blood, called cryoglobulins, clump together and cause inflammation and damage in the glomeruli, the filtering units of the kidneys. Understanding this disease is crucial for effective diagnosis and management, so let's get started. So what causes these troublesome cryoglobulins to form and attack the kidneys? The etiology of cryo-GN is varied, but it's most commonly associated with chronic hepatitis C virus infection. In fact, hepatitis C is implicated in a significant number of cases. Other potential causes include autoimmune disorders like Sjogren's syndrome, rheumatoid arthritis, and systemic lupus erythematosus. Certain blood cancers, such as multiple myeloma and Waldenstrom macroglobulinemia, can also trigger cryoglobulin production. In some instances, the cause remains unknown and it's classified as idiopathic cryoglobulinemia. Now let's explore the pathophysiology. Essentially, cryo-GN develops when cryoglobulins, which are antibodies that become insoluble at lower temperatures, precipitate and form immune complexes. These complexes then deposit in the glomerular capillaries, the tiny blood vessels within the glomeruli. This deposition triggers an inflammatory response, activating the complement system and attracting immune cells to the site. The ensuing inflammation damages the glomerular structure, leading to proteinuria, hematuria, and ultimately, impaired kidney function. Over time, chronic inflammation can lead to scarring and fibrosis of the glomeruli, progressing to chronic kidney disease. Understanding the epidemiology of cryo is key to recognizing at-risk populations. While the exact prevalence is difficult to pinpoint, it's estimated to a small percentage of individuals with hepatitis C virus infection. Hepatitis C is much more prevalent than cryo-GN in general, meaning you can have hepatitis C without this kidney issue. Cryo-GN predominantly affects adults, with the average age of onset typically between 50 and 60 years old. Women are more likely to be affected than men. It is also important to note that geographic location plays a role, with higher rates reported in areas with greater hepatitis C prevalence. Recognizing the signs and symptoms of cryo-GN is essential for early detection. Symptoms can be quite variable and often nonspecific, making diagnosis challenging. Common manifestations include palpable purpura, which are small, raised, reddish, purple spots on the skin, particularly on the lower legs. Other symptoms include fatigue, arthralgia, joint pain, myalgia, muscle pain, and peripheral neuropathy, which can cause numbness, tingling, or pain in the hands and feet. As kidney function deteriorates, patients may experience edema as swelling, hypertension as high blood pressure, and decreased urine output. In severe cases, cryo-GN can lead to rapidly progressive glomerulonephritis and kidney failure. Diagnosis of cryo-GN involves a combination of clinical evaluation and laboratory testing. The first step is often a suspicion based on the patient's symptoms and medical history, especially a history of hepatitis C or autoimmune disease. Blood tests are crucial, including cryoglobulin detection and quantification, complement levels, and tests for hepatitis C antibodies and viral load. A kidney biopsy is often necessary to confirm the diagnosis and assess the extent of glomerular damage. The biopsy sample is examined under a microscope to identify cryoglobulin deposits and signs of inflammation. Other tests, such as urine analysis and serum creatinine levels, help assess kidney function. Cryoglobulinemia can be classified into three main types. Type I cryoglobulinemia is associated with monoclonal immunoglobulin production, typically seen in blood cancers. Type A cryoglobulinemia involves monoclonal IgM with rheumatoid factor activity directed against polyclonal Ig. Type I2 cryoglobulinemia is characterized by polyclonal immunoglobulins, with polyclonal IgM rheumatoid factor activity directed against polyclonal Ig. Types DI and DI are often associated with hepatitis C virus infection and autoimmune disorders. Treatment of cryo focuses on managing the underlying cause and reducing inflammation. The first step is to treat any underlying infection. In cases of hepatitis C-associated cryo-GN, antiviral therapy with direct-acting antivirals can be highly effective in eradicating the virus and improving kidney function. Immunosuppressive medications, such as corticosteroids, rituximab, an anti-CD20 antibody, and cyclophosphamide, are used to suppress the immune system and reduce inflammation. Plasma exchange, a procedure that removes cryoglobulins from the blood, may be used in severe cases or when kidney function is rapidly deteriorating. Angiotensin-converting enzyme inhibitors or angiotensin receptor blockers are often used to control blood pressure and protect kidney function. Depending on the stage of kidney disease, dialysis or kidney transplantation may be necessary. Preventing cryo-GN is challenging, as it's often linked to underlying conditions. However, preventing hepatitis C infection through safe injection practices, screening of blood products, and avoiding high-risk behaviors is crucial. Early diagnosis and treatment of hepatitis C can prevent the development of cryo in many cases. For individuals with autoimmune disorders, careful management and treatment of the underlying condition may help reduce the risk of developing cryoglobulinemia. The prognosis of cryo varies depending on the severity of kidney involvement, the underlying cause, and the response to treatment. Early diagnosis and treatment can significantly improve outcomes. Patients with hepatitis C-associated cryo who achieve sustained virologic response with antiviral therapy have a better prognosis. However, some patients may progress to chronic kidney disease and require dialysis or kidney transplantation. Recent research is focused on developing more targeted therapies to reduce inflammation and prevent kidney damage. Studies are also investigating the role of novel biomarkers in predicting disease progression and response to treatment. Understanding how the immune system is triggered in this disease to attack the body's own tissues will help scientists develop new medicines that can more directly address the cause of the disease.